Welcome, and thank you for joining us today. This presentation is titled Building Capacity to Provide Culturally Safe Care, an approach to reducing harm and removing barriers for Indigenous women and gender-diverse people who use cannabis. As a note, throughout this presentation, the phrase Indigenous women and gender-diverse people will be utilized, and we'd like to clarify that this also encompasses people who are two-spirit, transgender, and of other gender diversities. Throughout this one-hour training, we'll explore how to strengthen understandings and approaches to cannabis care in a way that respects Indigenous perspectives, addresses trauma, and reduces stigma. This training aims to equip you with the tools and insights to provide more compassionate, inclusive, and effective care. This presentation will be comprised of 6 sections. These include a brief background context about the project, understanding Indigenous social determinants of health, trauma-informed care in social care settings, navigating cannabis use with clients, a case study, and Indigenous cannabis initiatives and resources. Let's begin by exploring the background of this project. We'll provide an overview of the Native Women's Association of Canada's Cannabis Project and outline the learning goals for today's session. To guide our discussion, we'll also highlight key Indigenous learning lenses that will frame our approach. As a disclaimer, the information presented today takes a pan-Indigenous approach to understanding cannabis. While the content has been developed from diverse community voices across the country, it's important to recognize that the information presented throughout is not representative of the opinions and feelings of all Indigenous individuals or communities. Funded by Health Canada's Substance Use and Addictions Program, the Native Women's Association of Canada, or NWAC for short, has conducted ongoing engagement and research to identify and improve the critical gaps in culturally safe and stigma-free cannabis education. This project takes a new approach to a long-standing dilemma. As more and more Indigenous women and gender-diverse people choose to use cannabis in its many forms, there still exists a lack of information available to health and social service providers, whether they're new to practice or have been practicing for years. This emerged as a priority topic during community engagement sessions and has highlighted the need for more Indigenous-led education that reduces the stigmatizing and oppressive norms. Cannabis use may serve a variety of purposes, from recreational to harm reduction, as a safer alternative to other substances. It can be used as medicine for a range of conditions, and for many other valid reasons. This project aims to provide health and social service providers with the foundational language and knowledge needed to enhance culturally safe care for Indigenous women and gender-diverse people who use cannabis. To accomplish this, NWAC has developed tailored webinars for 3 distinct groups, each with unique roles and learning needs. Today's webinar focuses on social care providers. While the learning objectives remain consistent across all 3 webinars, the approach and examples of each are tailored to align with the different professions' needs and responsibilities. To ensure that this project reflected the voices and needs of Indigenous women and gender-diverse people, a 7-member advisory circle was established. This circle brought together Inuit, Métis, and First Nations partners and included an elder, knowledge keepers, and representatives from primary care, allied health, and social service fields. The advisory circle collaborated across 8 content development meetings. Through sharing both their lived and professional experiences, their insights have provided the culturally safe and trauma-informed knowledge presented throughout today's session. Their dedicated work has ensured that this project remains meaningful, relevant, and responsive to the needs of Indigenous women and gender-diverse people who use cannabis. Prior to developing the webinars, NWAC surveyed 45 health and social service providers to better understand the current gaps in training and knowledge related to cannabis use and culturally safe care. From the results, 4 key learning goals emerged. They are understanding the difference between problematic and medicinal cannabis use. So by examining the distinctions between these patterns, providers can better support clients and recognize when cannabis use serves a therapeutic role versus when it may be a source of harm. Address stigma and personal views. Stigma around cannabis use remains a significant barrier, both in client-provider interactions and within healthcare systems. Through learning more about Indigenous perspectives and discussing cannabis use, we'll aim to reduce stigma and create more supportive environments. Discuss therapeutic approaches. We'll do this by discussing harm reduction, trauma-informed care practices, holistic health principles, and understanding cannabis use in a way that respects Indigenous perspectives and experiences. And lastly, we'll present resources and ongoing education materials. Since knowledge and practices are continually evolving, we'll highlight a variety of tools and resources that can support your ongoing learning and enable you to provide more informed and compassionate care. As we move through this presentation, you're encouraged to activate your two eyes and consider how both your trained perspective and Indigenous knowledge can be used together to better support client health and well-being. Two-eyed seeing is a concept that Mi'kmaq elder Albert Marshall introduced to encourage people to view the world through two perspectives. One eye focuses on Indigenous ways of knowing, while the other eye on Western scientific knowledge. By combining the strengths of both eyes, we can foster a respectful balance and create more holistic solutions. For example, this could look like working to integrate culturally significant foods into someone's diet while also considering Western nutritional guidelines, or collaborating with a traditional knowledge keeper to incorporate ceremonies or medicine into someone's mental health treatment plan. It's ultimately about recognizing the importance of fostering balance between cultural and clinical approaches. By incorporating Indigenous practices into care plans, you can help build bridges between Western and Indigenous methods and ensure that health solutions honor your client's cultural values. That leads directly into supporting holistic health. I'm sure you've heard of the World Health Organization's definition of health. That is, a state of complete physical, mental, and social well-being, and not merely the absence of disease. This aligns similarly with Indigenous perspectives of holistic health. Indigenous knowledge emphasizes the interconnectedness of all aspects of health, which can be visually represented through a circle of balance. While the medicine wheel is a well-known framework for this concept, it's important to acknowledge that it's not universal to all Indigenous groups. However, the idea of striving for balance is a shared principle across many communities. This concept of balanced health encompasses physical, mental, emotional, and spiritual dimensions, with each being equally as important in achieving well-being. When one's out of balance, the others are impacted. For example, physical health is often at the center of Western health approaches and treatments, but it's equally as critical to nurture our mental well-being, as it's fundamentally interwoven with our physical state. Further, our relationships and feelings, or emotional health, deeply influence our mental state. And spiritual health gives many people a sense of purpose, a connection to traditions, providing grounding and resilience. Together, these dimensions create a complete version of health that emphasizes balance, rather than just focusing on one aspect alone in isolation. As we move forward, whenever the word health is mentioned broadly, please keep this definition in mind. With this foundation in place, let's begin exploring key issues that shape health and social outcomes. In this section, we'll look at how understanding Indigenous social determinants of health, ensuring cultural safety, sharing power, and minimizing barriers all contribute to improving care and support for Indigenous women and gender-diverse people. What are the social determinants of health? Social determinants of health refer to the broader social, cultural, economic, and environmental conditions that influence a person's overall health and well-being. These factors go beyond individual choices or biological predispositions. The image on the slide illustrates a more holistic view of social determinants of health, including elements like family, connection to land, culture, language, and access to healthcare, along with more systemic issues like colonization, racism, and control of resources. All of these examples, or determinants, are interconnected and play a significant role in shaping health outcomes. Understanding social determinants of health requires recognizing how they're rooted in systems of inequities. For example, when people face legacies of colonization, like barriers to land access and control of resources, this directly impacts their environmental health, which could look like increased exposure to pollutants, or could prevent their ability to access culturally relevant and nutritious foods. Well, that's just a brief high-level overview. It's a reminder that many factors are constantly intersecting and directly impacting the ability for Indigenous people to achieve holistic health and well-being. There are many ways that the social determinants of health uniquely impact Indigenous women and gender-diverse people. First, systemic inequities underscore the majority of the social determinants of health. For Indigenous women and gender diverse people, the roles of colonization, racism, and sexism intersect to create barriers that perpetuate disparities in health, education, and resources. These systemic challenges often result in poorer health outcomes. Housing security and safety is another critical determinant. Indigenous women and gender diverse people often experience higher rates of housing insecurity and gender-based violence as legacies of the systemic inequities. These challenges can undermine one's stability and well-being, creating a cycle of vulnerability. There are also economic inequities, such as income disparities and employment barriers, which further exacerbate these issues. Limited access to stable income widens other gaps in social outcomes, such as the ability to secure housing, further education, and access culturally relevant and healthy foods. Access to healthcare is another significant social determinant. Systemic racism, discrimination, and stereotyping of Indigenous people often leads to poorer health experiences and resulting mistrust of health and social service providers. The absence of culturally safe care practices can further alienate many Indigenous clients from seeking care, while geographic barriers, such as living in remote areas, further limit access to services, creating inequities in emergency care and specialist availability. Additionally, a lack of inclusive and trauma-informed care often fails to address the unique needs of certain people, such as those who are two-spirit and gender-diverse individuals. Moreover, a connection to community and autonomy is vital for healing. Colonization and systemic policies have disrupted essential ties to land, family, and support networks, increasing social and health disparities. All the while, the justice system also plays a significant role. Indigenous women and gender diverse people are overrepresented in areas like child welfare and incarceration, which perpetuates cycles of inequity and compounds the other effects of the social determinants of health. And finally, cultural safety and identity are also deeply tied to well-being. Many Indigenous people experience cultural disconnection due to colonization and the attempted erasure of Indigenous identities, such as being two-spirit. This separation can lead to feelings of isolation, mental health struggles, and a lack of belonging. These are just a few brief examples of the many unique intersections of the social determinants of health. By recognizing the ways that these issues impact health, we can work to better address inequities and support multifaceted approaches to wellness. With that being said, let's take a closer look at one of those factors, cultural safety. Cultural safety is an essential framework for ensuring equitable, respectful, and inclusive care. Unlike cultural awareness or sensitivity, cultural safety goes beyond understanding or acknowledging cultural differences. It focuses on creating environments where power imbalances, discrimination, and stereotypes are actively addressed and eliminated. This framework acknowledges and addresses the ongoing effects of colonization, intergenerational trauma, and systemic racism. It requires understanding how these factors have deeply affected Indigenous people while centering Indigenous knowledge systems, practices, and voices in all aspects of care. Cultural safety aims to foster trust by creating environments where clients feel valued and truly understood. By integrating cultural practices and honoring clients' lived experiences, providers can help mitigate feelings of marginalization and create a foundation for meaningful collaboration. As care providers, fostering cultural safety starts with introspection. Reflect on the power dynamics present in your relationships with your clients. Are you making decisions for them, or are you working alongside them? Consider your own biases and take deliberate steps to challenge stereotypes or assumptions that may unconsciously inform your actions. A powerful tool in this process is self-reflection. Ask yourself, am I a safe person to work with? What would make me safer in the eyes of my clients? These questions are not only one-time considerations, they're an essential part of ongoing practice. By regularly reflecting and adapting, you can continuously improve your ability to provide culturally safe care. A part of ensuring cultural safety is considering how power is shared. You may have heard the word empowerment used when describing how to help clients. However, this term inherently implies a hierarchical top-down dynamic where power is given from one person to another. Instead, we encourage you to think about sharing power, which reflects a collaborative, respectful partnership. Indigenous women and gender diverse people inherently possess resilience, strength, and knowledge, demonstrating their incredible power. The role of a social care provider is not to grant them power, but instead to help remove the systemic barriers and help them utilize their power. As one of our advisory circle members stated, the medicine is already within us. We have the power to heal ourselves. By prioritizing the following steps, you can work towards building relationships that are rooted in mutual respect and foster the client's inherent strengths and agency. Let's explore 4 key steps for sharing power. Honoring traditional roles in communities. Indigenous women and gender diverse people have historically held vital roles as caregivers, leaders, and knowledge keepers within their communities. These roles remain integral to the well-being of Indigenous cultures today. It's important to recognize and support the revitalization of these roles by recognizing the client's power, ensuring services respect and affirm their lived experiences, and offering culturally relevant resources. Provide tools, not dependence. Rather than creating reliance on your services, it's important to provide tools that help your client take ownership of their journeys. This can be through building confidence and capacity to navigate challenges independently, through offering guidance, providing resources, and making connections to further skills training. This approach fosters resilience and allows individuals to reclaim agency in their lives and decisions. Cultivate supportive environments. Creating a safe and respectful place is critical for all Indigenous and gender diverse people to explore and assert their strengths. This involves modeling respect, advocacy, and belief in their potential. By encouraging incremental steps towards their goals and celebrating their progress, providers can help clients build confidence and develop their sense of agency. It's about guiding, not controlling the path forward. And foster shared decision-making. Collaboration is key to sharing power effectively. Engage clients in meaningful dialogue where their lived experience and expertise are valued as central to the planning process. By co-developing solutions and avoiding assumptions about what's best, providers can ensure strategies are not only effective, but also deeply aligned with the client's cultural, personal, and community contexts. This approach fosters trust and builds stronger partnerships. It's also just as important to help reduce barriers when supporting people. First, fostering cultural safety and understanding is essential. Aside from all the tips we just discussed, providers can further prioritize culturally safe interactions by partaking in additional trainings that deepen their understandings of Indigenous histories, traditions, and worldviews. Develop understanding by recognizing and acknowledging the challenges your clients may face when navigating things like their cannabis use. It's crucial to engage in open, compassionate conversations, creating a safe space for them to discuss their concerns. As cannabis-related information evolves, it's important to remain up to date on the latest knowledge. Second, addressing systemic barriers requires advocacy and practical interventions. Providers can connect clients to critical resources, advocate for policy changes, and help remove barriers like transportation, financial costs, and language challenges. Ensuring that the services you provide and recommend are designed to be culturally safe is fundamental to promoting equity and access. In addition, recognizing the broader social determinants of health is key. Being proactive in identifying and addressing these barriers can help create a more supportive atmosphere for Indigenous clients. And finally, emphasizing collaboration in care planning strengthens support systems. Social care providers can connect clients to community supports and coordinate services and referrals collaboratively with other health professionals, such as doctors, pharmacists, peer support workers, and cultural advisors. Collaborative approaches to care planning ensure that clients' primary care, allied health, and community needs are met comprehensively. In situations where you can't collaborate or refer, even sharing fact sheets or other accessible resources that are tailored to the specific needs of the client can help them navigate their health more effectively. Expanding on that, it's critical to consider how lived experiences shape interactions within healthcare settings. Let's explore how a trauma-informed framework can help us better understand and address the impacts of trauma. Trauma itself is a response to distressing events, whether that's a single incident or prolonged exposure to adversity. It affects holistic health and well-being and fundamentally shapes how people perceive and interact with the world around them. A trauma-informed approach to care recognizes how common trauma is and how it affects all aspects of people's lives, including their interactions with service providers. The goal is to create a safe space where clients feel supported and in control. For Indigenous women and gender-diverse people, this means understanding how historical and ongoing acts of colonization continue to shape their lived experiences. It's also critical to understand that trauma-informed care doesn't mean asking clients to relive or reflect on their trauma. Instead, it shifts the focus to their strengths, the resilience that they've developed in surviving trauma, and how that resilience can become a foundation for healing. When this approach is not utilized, there's a risk of causing re-traumatization, which can leave clients feeling unsupported or even blamed. This could discourage them from seeking services again, further exacerbating barriers to care. The process of becoming trauma-informed requires that you first recognize how significant the impacts of colonization are on the lives of Indigenous women and gender-diverse people. Historic and ongoing processes like the residential school system, the 60s and millennial scoop, the foster care system, forced and coerced sterilization, gender-based discrimination within the Indian Act, high rates of incarceration, and theft of land and resources, among many other factors, have all had deep intergenerational effects. Acknowledging that these things impact your client is critical for you helping to create culturally safe environments and offer compassionate care. All of us carry a set of values formed by a variety of influences over our life course. These values, whether conscious or subconscious, inform how we engage with others. It's important to recognize how our work is influenced by our perspectives and to question how structural racism, discrimination, and biases have been built into the health and social service systems. We must consider how these systems specifically affect Indigenous women and gender-diverse people's ability to access services in a respectful and dignified way. Through these reflections, we can begin to apply two-eyed seeing. This allows us to recognize and respect the ways that traditional knowledge and biomedicine can coexist. Integrating these approaches simultaneously provides an opportunity for clients to make more culturally relevant, balanced decisions regarding their health. Some further tips for providing trauma-informed care are that it's important to remember that you don't need to know the specific trauma a person's experienced to provide trauma-informed care. What matters is creating a safe, supportive environment where clients feel respected and heard. Be mindful of your positionality and privilege. This means recognizing how your own identity, background, and experiences influence your interactions with clients. For instance, avoid medical jargon and use plain language to ensure shared understanding. Let people know that you want to work with them and do not simply tell them what to do. Another aspect is practicing empathetic listening. It's about listening with intention, without interrupting or rushing to solve the problem, and without imposing your own beliefs or assumptions. Ask clients how you can make their visit or appointment more comfortable. Finally, helping clients to make decisions that best support their holistic health and well-being is central to trauma-informed care. Providing clients with the information and options they need to make choices that feel right for them, while respecting their autonomy, helps foster resilience and healing. Next, we'll be discussing how to recognize and respond to trauma activation. As a note, we'll be using the term activate instead of trigger when referring to something that awakens a memory, feeling, or symptom related to trauma. The reason for this change is that the word trigger carries violent connotations, and that can intensify people's emotional responses. Our advisory circle elder explained that trauma is energy that's physically locked within the body. Using the term activate is a gentler way to describe the experience without causing further harm. Trauma activation can occur in response to various stressors, including environmental, sensory, or interpersonal cues. These may include specific sounds, smells, places, sensations, confrontations, or even particular words or phrases. Activations are deeply personal and unpredictable, so it's essential to remain attuned and sensitive during your interactions. There are several signs to look out for when someone's experiencing a trauma activation. Physical signs may include increased heart rate, sweating, shaking, or appearing physically frozen. Emotional responses can range from fear, anger, to sadness, to shame, or numbness. Behavioral signs include avoidance, hypervigilance, unexpected outbursts, or freezing. And on a cognitive level, individuals may be experiencing flashbacks, intrusive thoughts, confusion, or distorted thinking. Recognizing these signs allows us to provide appropriate and sensitive support. When responding to trauma activation, the first step is to validate the person's experience. Acknowledge their feelings without judgment and let them know their emotions are valid. Create a safe and calm environment where they feel secure. Offering grounding or coping techniques such as deep breathing or sensory focus exercises can help, but it is important to let the person guide the process and choose what feels right for them. Be patient and avoid pushing them to share more than they're ready for. Above all, it's important to ensure that they feel in control of the situation. Experiences of trauma often leave people to feel powerless. So as a care provider, it's important to ensure that they have options and control over what happens next. This might look like asking if they'd like to stop the consultation, if they want to continue, take a break for a few minutes, etc. By understanding common stressors, recognizing the signs of activation, and responding with empathy and care, you can create a supportive space that fosters trust and helps individuals feel safe. Finally, having a trusting relationship is an essential foundation for providing trauma-informed care. This can be fostered by creating safe physical and emotional environments where clients feel respected and free from judgment. In a physical space, this could look like rooms being soundproof and more private, ensuring accessible design features like ramps, wide doorways, and clear signage, or even incorporating calming colors throughout. Emotional safety could be achieved by using inclusive language, being mindful of pronouns, and ensuring that staff are trained in understanding diverse identities, including those of two-spirit, transgender, and gender-diverse people. Setting clear and consistent boundaries to foster trust and predictability in the client-provider relationship. This includes being clear about expectations, maintaining consistency in how you engage, and allowing space for people to ask questions or express concerns as they arise. Share power with clients by involving them in the decision-making and respecting their autonomy. This means engaging in ongoing conversations about their care options and preferences, providing them with tools they need to make informed decisions, and encouraging them to express their needs and concerns openly. Prioritizing cultural safety by honoring clients' diverse experiences and traditions. Be open to learning about cultural practices and tailoring care to be culturally appropriate. It's important to approach conversations with humility and curiosity, continuously learning and evolving to create an environment where clients feel valued and understood. And finally, remain flexible with treatment options. This may involve discussing different treatments, acknowledging potential barriers to access, and offering choices that feel right for the individual. Most importantly, all treatment decisions should be made with ongoing informed consent, ensuring that clients feel comfortable at every stage of their care. Now let's focus on how to apply all the important pieces we've discussed when navigating cannabis use with Indigenous women and gender-diverse clients. In this section, we'll explore more about cannabis use, harm reduction, and help guide supportive conversations. Reduction is an evidence-based, client-centered approach that focuses on reducing the health and social harms associated with risky actions. It emphasizes meeting people where they're at and supporting them in ways that align with their individual goals and circumstances. Unlike traditional approaches to substance use that often demand abstinence, harm reduction provides a more inclusive and flexible alternative. By using non-judgmental and non-coercive strategies, harm reduction minimizes risks while offering opportunities to connect people with resources, peer support, and services, ultimately reducing substance-related health and social challenges. When it comes to Indigenous clients, there are additional considerations to take into account. As we've discussed, systemic racism in healthcare continues to act as a barrier, preventing many Indigenous women and gender-diverse people from accessing culturally safe supports for cannabis use. Additionally, Resources and services are often concentrated in urban centers, leaving rural and remote communities underserved. It's vital to envision how supportive care can be adapted to these settings to ensure equitable access. Through a harm reduction approach, we can help build supportive environments where clients have the power to pursue health and wellness in ways that are authentic to them. Now let's dive deeper into understanding cannabis, beginning with the foundational concepts. Cannabinoids are the active chemicals in cannabis plants that interact with our body and brain when consumed. There are over 100 different cannabinoids, and they work by interacting with a system in our body called the endocannabinoid system, or ECS. Interestingly, our bodies naturally produce similar chemicals known as endocannabinoids, which play an essential role in regulating stress, mental health, immunity, and overall wellness. Cannabinoids from cannabis mimic these natural chemicals, fitting into the ECS in much the same way and influencing how our bodies respond. The two most well-known cannabinoids are tetrahydrocannabinol, or THC, and cannabidiol, or CBD. THC is responsible for the psychoactive effects of cannabis, commonly referred to as the high. It works by fitting into the ECS like a key in a lock, temporarily replacing the body's own endocannabinoids. On the other hand, CBD typically does not produce a high. Instead, it interacts with the ECS to enhance the effects of our own natural endocannabinoids. CBD may even reduce some of THC's psychoactive effects if it's present in equal or greater amounts. While CBD is often thought of as the medical cannabinoid, it's important to note that THC also has therapeutic potential. In medical cannabis use, people often utilize a combination of cannabinoids, as both THC and CBD offer unique benefits depending on the condition being treated. When it comes to understanding cannabis products, it's helpful to categorize them into three main types based on their THC and CBD content. THC-dominant products are high in THC and have minimal CBD, resulting in a stronger euphoric effect, or high. However, these products also carry a greater risk of undesirable effects like paranoia or discomfort, especially at higher doses. CBD-dominant products, on the other hand, are high in CBD and low in THC, offering little to no high and are generally a milder, more relaxing experience. Lastly, balanced products have a mix of THC and CBD in ratios like 1:1, 1:2, or 1:3. These are more likely to create relaxing, body-focused effects with less of the stimulating high often associated with THC. Beyond the product type, the method of consumption is also a key factor. Cannabis can be consumed in a variety of ways, such as smoking, vaping, ingestion, sublingual drops, topical applications, juicing, nasal sprays, suppositories, and transdermal patches. Each method has unique effects, durations, and purposes, which is why finding the right combination of product and consumption method can be a trial and error process. It's essential to consider individual needs and goals to identify the most suitable option. Something important to consider is the intention behind cannabis use. Intention is critical to the outcomes of health and wellness. The way we approach plant medicines, our mindset, purpose, and respect determines the relationship we cultivate with them. When cannabis is utilized with mindfulness, it can help align the individual better to its purpose. Without intention, there's a risk of becoming disconnected from the traditional values and teachings associated with it. Cannabis has historically had a variety of uses for Indigenous people. Beyond practical applications, such as using hemp for tools, various forms of cannabis consumption have also promoted balance and healing by addressing physical ailments, calming the mind, and fostering emotional and spiritual connections, reflections, and grounding. For some, cannabis also represents a connection to the land and sustainability, reinforcing its role as a sacred plant by intertwining cultural practices and environmental harmony. This highlights just some of the various and multifaceted, deeply rooted relationships Indigenous people may have with cannabis. As a health provider, it's important to approach conversations with respect and recognition of how relationships with cannabis use are diverse and shaped by unique historical, cultural, and social contexts. Avoid making assumptions about why someone uses cannabis or the potential impacts it may have on their health and well-being. Instead, create a safe and open place for discussion that respects the individual's experiences and choices around their cannabis use. In Canada, cannabis is legal for adults who meet the minimum age requirement, which ranges from 18 to 21, depending on the province or territory. In Alberta, the legal age is 18. In Quebec, it's 21. In all other provinces and territories, it's 19. Adults have the right to include cannabis in their personal health and wellness practices, and respecting their autonomy in that choice is key. Most cannabis research is still in the early stages due to regulatory processes. It takes years to gain approvals, secure funding, and pass preclinical trials before clinical trials involving humans can take place. However, it is becoming increasingly recognized for its potential to alleviate various physical and mental symptoms, such as pain, anxiety, PTSD, nausea, vomiting, for palliative care end-of-life transitions, and sleep disorders, among many other uses. As a result, many people are turning to cannabis to help manage their chronic health conditions. Additionally, cannabis can also help manage withdrawal symptoms, making it a supportive option for those transitioning away from other substances. For instance, it's a legitimate and safer option for pain management, particularly for those who may otherwise rely on opioids. Long-term opioid use carries risks of significant health and social harms, including the potential for drug poisoning. In contrast, cannabis offers pain relief without severe side effects associated with opioids. While there's still risks with cannabis use and potential for dependency, it could be an option when abstinence from substances is not realistic for someone. Considering the use of cannabis as an alternative to other substances is especially relevant for Indigenous people, as they're disproportionately impacted by the drug poisoning crisis. Systemic inequities and ongoing traumas have contributed to higher rates of substance use in Indigenous communities, and cannabis may provide a culturally safe, alternative harm reduction strategy to mitigate these risks in certain scenarios. In discussing the medicinal benefits of cannabis, it's also important to acknowledge that there's a risk that cannabis use can become problematic. Cannabis use disorder, CUD, is a condition that can develop with regular cannabis use over time. While cannabis use itself is not inherently problematic, regular use over a prolonged period can lead to mild physical dependence, and stopping can cause mild physical withdrawal symptoms. However, not everyone who uses cannabis regularly will experience these effects. CUD is a medical term used to describe a spectrum of cannabis use patterns, ranging from mild to severe. The condition is diagnosed when a person experiences at least 2 of the symptoms consistently over a 12-month period. These symptoms are listed on the slide and include things like using larger amounts of cannabis than intended, trying unsuccessfully to cut down, or continuing use despite negative consequences at work, school, or in relationships. It's important to note that while these symptoms are used to define CUD, most people who use cannabis will not experience all or even any of them. Regular cannabis use or enjoying cannabis does not necessarily equate to problematic use. However, if any of these symptoms apply and cannabis is negatively impacting a person's life, it may be time for them to reassess their relationship with cannabis and consider taking a break. This slide provides guidance and tips for supporting clients to mitigate the risks of cannabis use from a harm reduction lens. First, it's important to understand that cannabis use can lead to tolerance over time, meaning the body's cannabis receptors stop reacting as strongly to THC. This is reversible, and a tolerance break, where a person abstains from using any THC for at least 2 weeks, can help reset this sensitivity. For heavy use, it may take up to a month, but even after just a few days, the body's receptors begin to reverse the tolerance. While THC tolerance builds up, CBD interacts with the body's receptors differently, making it unlikely for people to develop a tolerance to CBD. This provides an alternative option for some people who may not want to take a full break from cannabis. They could use CBD products for therapeutic benefits or to manage withdrawal symptoms without the risk of tolerance. If a client is either unwilling or unable to take a full tolerance break, you could help them explore other strategies. For example, switching strains can provide a different cannabinoid profile that may help mitigate tolerance. Using more balanced products with higher CBD and little to no THC is another option. Additionally, microdosing, involving consuming small amounts of cannabis throughout the day, allows clients to gain therapeutic effects of THC without building tolerance. Another option that may work for some people is varying their routines. Consuming cannabis at the same time every day can cause the body to expect stronger effects, leading to greater consumption. Waiting until later in the day or switching up the time of use could help manage this. And lastly, you could suggest using smaller amounts of cannabis, like smaller rolling papers or bowls, or even opting for edibles, which offer longer lasting effects with less cannabis. Tailoring cannabis conversations involves a thoughtful, culturally respectful approach. Let's briefly review the foundational principles we've discussed. Ensure care environments are culturally safe and sensitive to past and ongoing trauma. Respect and affirm the intersecting identities of Indigenous women and gender-diverse people. Blend traditional Indigenous healing practices with Western health approaches to provide more holistic wellness. Consider how social determinants of health may impact health and access to care. And emphasize practical harm reduction strategies that align with your client's goals and minimize risks. Now, a key aspect of tailoring cannabis conversations is providing individualized advice. This involves understanding and addressing each client's unique needs, experiences, and contexts. For beginners, this may mean starting with education on cannabis basics, such as the differences between THC and CBD, consumption methods, and potential effects. For more experienced users, guidance may focus on managing tolerance and refining usage to align with long-term health and social goals. Some things to consider when supporting cannabis use in clients are helping clients understand strains or products that match their preferences, therapeutic needs, and underlying medical conditions. For example, clients managing anxiety may benefit from CBD-dominant products, while those addressing chronic pain might explore balanced THC-CBD options. Offer practical advice on forms of cannabis, like edibles, oils, or topicals, and methods of consumption that align with the client's comfort level and goals. Discuss harm reduction methods around use and what effects they might expect, including things to monitor. And finally, ensure that recommendations resonate with the individual's personal and cultural contexts. When discussing cannabis with youth, it's important to emphasize the heightened risks due to the brain's ongoing development until around age 25. Regular cannabis use during this critical period can have lasting effects on both physical and mental health. Physically, cannabis can affect brain function, leading to challenges with memory, concentration, and decision-making. There's also a risk of developing a physical dependency on cannabis, which can make it harder for youth to reduce or stop their use. Additionally, youth who use cannabis regularly are more likely to smoke cigarettes and experience respiratory issues similar to those caused by tobacco use. There are also mental health risks. Regular cannabis use in youth increases the likelihood of experiencing anxiety, depression, psychosis, and in some cases, schizophrenia. Beyond health risks, cannabis may also affect a young person's overall life trajectory. Recreational use could lead to reduced academic performance, diminished participation in extracurricular activities, and a lack of interest in hobbies or peer groups they once enjoyed. These changes could compound feelings of isolation and strain relationships with family and friends. To address these risks effectively, it's crucial to foster ongoing, open, and non-judgmental conversations about cannabis. These discussions should be grounded in evidence-based information, presenting both the risks and potential benefits of cannabis use. Presenting the positives of cannabis use is important because it helps inform youth that cannabis is not always bad, and there are many circumstances where cannabis use can be helpful. This helps counteract stigma and encourages youth to engage in thoughtful, informed decision-making. Ask open-ended questions, use accessible language, and promote harm reduction strategies. For example, you could encourage reducing use, opting for lower THC products, and avoiding mixing cannabis with other substances. By creating a supportive and balanced dialogue, you can help share power with youth to navigate their relationship with cannabis in a way that prioritizes their health and autonomy. Part of the misinformation around cannabis use is due to stigma and discrimination. The stigma surrounding cannabis use is deeply rooted in colonial systems of control. Extending beyond criminalizing a plant, these laws represent broader racist policies aimed at policing Indigenous bodies and cultural connections to plant medicine. Prohibition reinforced harmful stereotypes, and that legacy continues to shape how Indigenous people perceive and access cannabis, especially within the context of health and social systems. When working with Indigenous women and gender diverse people, it's essential to consider how intersectional experiences, such as gender, sexual orientation, socioeconomic status, disability, and culture, can compound stigmatization and create additional barriers. Care provision must be approached from culturally safe and trauma-informed lenses to ensure equitable and compassionate support for a person's complex health and social needs. Another essential approach is using non-stigmatizing language. Words and language are powerful for creating connections and fostering trust and respect in relationships. Avoiding language that perpetuates stereotypes or demonstrates judgment can help create open spaces for more supportive dialogue surrounding cannabis use and its role in well-being. Finally, it's important to acknowledge the diversity of viewpoints Indigenous communities and individuals hold around cannabis. While many embrace cannabis and connect it to cultural practices and tradition, many also outright reject it and oppose it due to legacies of colonial trauma and influences driving stereotypes. This polarization can result in people who use cannabis being excluded from community ceremonies or events. It's also important to approach cannabis conversations sensitively. Perspectives and experiences will differ across individuals, communities, regions, and generations. Let's move into a practical application of these concepts. In this section, we'll explore a case study featuring an example of how a social care provider might respond to a client accessing cannabis. This will highlight both the challenges and opportunities for improving client care through culturally safe and trauma-informed approaches. Before we get started, we want to acknowledge that this case study is fictional. However, it was developed by the advisory circle based on their personal insights and real lived experiences of working in and interacting with social care settings. This case study presents Lyric's experience. Her background highlights common challenges faced by Indigenous clients when seeking support. This case will serve as a foundation for exploring strategies to create safe spaces where clients feel comfortable sharing their needs without fear. Lyric, she, her, is a 28-year-old Indigenous mother of 2 young children. She has recently started working with a social care provider, Lisa, to access support services for housing and parental resources. Lyric is hesitant to disclose her cannabis use, which she relies on to manage anxiety and chronic pain. Her apprehension stems from worries of being judged, stereotyped, or even reported to child welfare services, a fear rooted in intergenerational trauma experienced in Lyric's family. Lyric approaches the relationship cautiously, uncertain of Lisa's intentions and whether she can trust her. She feels the weight of previous negative experiences with health and social service systems, which have often invalidated her experiences and reinforced harmful stereotypes. Social care providers navigate sensitive conversations with clients like Lyric to build trust and address their concerns effectively. Let's start with opening the conversation. Start by gently inviting discussion without making assumptions. For instance, Lisa could ask open-ended questions such as, I know stress can affect us in different ways, and I want to make sure you have the space to share whatever feels important today. Is there anything that you've been facing lately that you'd like to talk about? This approach demonstrates curiosity and care rather than judgment, encouraging Lyric to share at her comfort level. Allowing clients to take the lead. Lyric's hesitancy means it's crucial to let her guide the pace and focus of the conversation. Lisa might say, we can explore whatever feels most important to you today. You're in control of what we discuss. I will follow your lead. I'm here to listen and support. Giving Lyric autonomy shows respect for her boundaries and builds a foundation of trust. Creating safety around sensitive topics. Lisa can foster safety by normalizing conversations about cannabis and being transparent about her role. For instance, she could say, many people explore different ways to manage their well-being, including natural and alternative methods. If cannabis is ever something you'd like to talk about, I'm here to listen without judgment. Validating and reassuring. Acknowledging Lyric's fears is key. Lisa adds reassurance up front about the confidentiality of their conversations, emphasizing this is a safe space. She might say, It's completely understandable to have concerns about being judged or how this information will be used. I want to assure you that our conversation is confidential and centered on your well-being. This helps assure Lyric that her experiences are valid and will be approached with respect. Addressing fears with transparency. It's essential to address fears directly and provide clear information. Lisa could explain, I understand there's often fear around sharing personal information, especially with the history of how Indigenous families have been treated in social systems. I want to be transparent about my role, which is to support you in accessing resources that meet your goals. If any issues come up that require further steps, we'll navigate them together. Collaborative problem solving. Finally, if Lyric does disclose cannabis use, Lisa can work with her to address any concerns or challenges collaboratively. For example, Lisa might say, "Thank you for sharing that with me. Let's talk about how cannabis fits into your life and any concerns you may have about its impact. Let's work together to figure out what feels right for you. I'm here to support you in finding options that align with your goals and values." This approach reinforces trust and ensures Lyric feels supported in making decisions that reflect her goals. This scenario demonstrates several positive actions that highlight the importance of trauma-informed, culturally safe practices. By fostering a non-judgmental and open environment, Lisa helps Lyric feel safe and validated, which strengthens their therapeutic relationship. Sharing power with Lyric to take an active role in her care builds her confidence and autonomy, ensuring she feels in control of her decisions and is willing to access support. Transparent communication will also alleviate Lyric's fears about judgment or child welfare involvement, directly addressing her anxieties. This allows Lyric to feel more comfortable and open about disclosing her cannabis use, which in turn enables Lisa to provide the necessary support and guidance for further information and harm reduction measures. Open communication and shared decision-making create a stronger sense of trust. In reflecting on the case study with Lyric, several key takeaways emerge that are crucial for providing effective, culturally safe support in social care. Trust in the provider relationship is fundamental, as Lyric's willingness to disclose her cannabis use is directly tied to how supported and understood she feels. Trauma-informed care is also essential, particularly when working with Indigenous clients, as it helps providers address the impacts of intergenerational trauma and past negative experiences with the systems. Allowing clients to lead in their care processes gives them the power to share what's important to them, fostering a collaborative dynamic. Creating safe spaces for sharing is critical, ensuring that clients feel comfortable discussing sensitive issues without fear of judgment or repercussions. And finally, collaboration enhances client outcomes by ensuring care plans are tailored to individuals' needs, leading to better, more personalized support. The next section highlights Indigenous-specific resources that promote culturally relevant cannabis education and harm reduction practices. Many of these initiatives are designed by and for Indigenous communities, integrating traditional knowledge, lived experiences, and trauma-informed approaches. The first Indigenous-led initiative we'd like to highlight is NWAC's own cannabis education website. This website is part of a larger project titled A Community-Informed Approach to Cannabis Public Health Education and Awareness. Through this project, NWAC engaged urban, rural, and remote Indigenous communities and identified the current awareness and priorities of Indigenous women and gender-diverse people around cannabis public health education. The website offers a wealth of information, tools, and resources. Cannabis in Canada explains how to read labels, understand consumption methods and effects, assess potency, and navigate cannabis laws across provinces and territories. Cannabis Basics covers the anatomy of cannabis, differences between compounds like THC, CBD, and terpenes, growing and harvesting practices, and it debunks myths. History and Traditional Stories includes an elders section with personal accounts and a historical timeline of cannabis in Canada. The cannabinoid dose calculator helps people determine the best dosages for their needs. Paired with the cannabis dosing and symptom log, this tool supports personalized and informed cannabis use. Cannabis and Health features detailed sections on parenting, youth, pregnancy, lactation, seniors, and the use of cannabis with other substances. Cannabis and Medical Use guides people through the prescription process, helping them determine if medical cannabis is right for them and what to expect. Cannabis Use Disorder explores diagnostic criteria, tolerance management, and cannabinoid hyperemesis syndrome, offering strategies like reducing dosing or tolerance breaks. And finally, the resource section provides downloadable fact sheets in English, French, and Inuktitut, and access to NWAC's published reports on cannabis education, cannabis and mental health, and cannabis use during the perinatal and postpartum period. There are also many resources provided by the First Nations Health Authority. The Care Through Connection, Cannabis Use Across the Lifespan document is designed to support healthcare providers in facilitating open, compassionate conversations about cannabis use. It emphasizes a harm reduction approach that's person-centered, trauma-informed, and culturally safe, ensuring that providers are well equipped to offer care to First Nations people. In addition, their website offers a range of valuable tools and information, including mobile apps for managing mental health, cannabis resources for both healthcare providers and the community, education materials on cannabis, maternal health, safer cannabis use, and support for youth. The State of Métis Knowledge on Cannabis and Mental Health in Canada is a key resource developed by the Métis Nation Council. This document provides a high-level overview of cannabis use in Canada and its relationship with mental health, specifically to inform future research areas for Métis communities. The report identifies significant gaps in existing literature regarding cannabis use and mental health outcomes for Métis people, a critical limitation requiring further attention. This is a valuable tool for fostering discussions around creating more inclusive and Métis-focused research and resources. Let's talk about Ujarek is a cannabis harm reduction toolkit created by the Patutik Inuit Women of Canada. This toolkit is guided by Inuit values and is designed to increase knowledge about cannabis use and how to reduce potential harms, all while taking a trauma-informed and strength-based approach. These materials are tailored to support new and expecting parents, youth, and the broader Inuit community in making informed decisions about cannabis use. Service providers can also benefit from these resources. For example, the discussion guides for starting conversations around cannabis use provide practical strategies for initiating supportive dialogue. The Reflecting on My Cannabis Use tool is a short, anonymous activity designed to help individuals reflect on their cannabis use, assess its impact, and explore relevant resources based on their decisions. Additionally, the toolkit features beautifully designed posters and fact sheets available in English and several Inuit languages. These materials are perfect for display in workplaces or community settings to increase awareness and spark conversations. There are also research resources that would be valuable for understanding various topics surrounding cannabis and health. NWAC's research paper titled Conversations on Cannabis and Mental Health was published in 2023 in the International Journal of Indigenous Health. It explores the needs and experiences of Indigenous people regarding cannabis use and mental health, with 4 key recommendations being outlined. There's also the Canadian Centre of Substance Use and Addictions report titled Clearing the Smoke on Cannabis. It was published in 2024 and presents up-to-date research findings on cannabis use for a variety of health issues, such as pain, cancer, fibromyalgia, neurological disorders, and substance use disorders. And although this was published in 2018 and is not currently up to date, another useful resource is Health Canada's Information for Healthcare Professionals website. It's a publication that provides an extensive background summary of cannabis health research and details recommendations and advice surrounding topics like clinical pharmacology, dosing, potential therapeutic uses, precautions, and adverse effects. This slide provides additional resources that can support further learning and practices related to Indigenous cannabis use. These resources include toolkits, policy documents, and research findings that highlight different perspectives, challenges, and approaches to cannabis use within Indigenous communities. To conclude, we wanted to highlight NWAC's Anti-Indigenous Racism Toolkit for health and social care providers. This resource is designed to support health and social care professionals in addressing and reducing racism in their daily practices. This toolkit acknowledges the challenges that Indigenous people, especially women, girls, two-spirit, transgender, and gender-diverse individuals, face when accessing services. Many have experienced systemic racism or medical trauma, making these interactions intimidating and re-traumatizing. Practical strategies include tools like post-visit surveys to collect feedback in a safe way, and guidance on understanding the needs of Indigenous clients. We encourage you to explore this toolkit and consider how its principles can enhance your practice. That brings us to the end of this presentation. Thank you for taking the time to engage with us on this important topic.